Well, hello there. I am Dr. Chongoshapi, a resident general surgeon, and today I would like to discuss peptic ulcer disease with you. Peptic ulcer disease is what people commonly refer to as ulcers. Yo nalikwatama ulcers. But peptic ulcer disease involves the development of peptic ulcers. Peptic ulcers are painful sores that develop on the inside layer of the stomach or the first part of the intestines. This happens when the protective layer of mucus that covers or overlies the inner lining of the digestive tract is made to break down or is disrupted, leaving exposed the cells of the stomach as well as the first part of the intestine. Now, you have to know that during the process of digestion, the stomach is known to secrete or to produce an acid that helps with the process of digestion. This acid is then now what is going to cause damage to the cells of the stomach as well as or the first part of the intestines if that particular part is lacking the protective layer that's supposed to guard it from damage. And when that happens, there will be a wound or a sore that's going to develop on the stomach or the first part of the intestines. And then the manifestation will be peptic ulcer disease, or what you commonly refer to as ulcers. So one would be interested to ask, what are some of the things that can cause this protective layer to break down? There are quite a number, but of note, there are two most important things that may cause disruption of this protective layer. Number one is a bacteria. This bacteria is known as Helicobacter pylori, or abbreviated as H. pylori. So presence of this bacteria in the digestive tract allows it to cause damage to that protective layer such that it ends up breaking down, leaving exposed the cells or the inner lining of the stomach or the intestines. And when that happens, exposure of that particular site to the acid that is produced as the body is trying to achieve the process of digestion may now end up causing a damage, and the damage will produce sores, and sores will cause the peptic ulcer disease. The other thing that causes a disruption in this particular protective layer is abuse of drugs. Which drugs? Drugs known as NSAIDs. So these NSAIDs are painkillers that are easily attainable, even over the counter. These include brufen, diclofenac, aspirin, etc. These drugs have the capability to cause damage to this protective layer such that it breaks down, leaving exposed the cells of the stomach or the intestines, and when there is contact with acid that is produced in the stomach as the body is trying to conduct the process of digestion, then what's going to result is damage, and then ultimately there will be development of peptic ulcer disease. So some of the common symptoms of peptic ulcer disease include abdominal pain. So this pain is located a little bit upwards in your belly, and it's gnawing, and it's dull, and it's steady. And what makes it unique is that it's associated with eating habits. It becomes worse when you are starving or when you haven't eaten, but then it may be relieved by taking an antacid, or even when you just eat something. Another symptom may be nausea, bloating. Some people may even develop vomiting because of peptic ulcer disease. Management of peptic ulcer disease is quite important. Why? Because it involves identifying what may have caused the disease in the first place. Is it the abuse of the painkillers, or is it the presence of the bacteria? However, medication is given depending on the cause. You may be given antacids, antibiotics, And then you may be given some advice regarding lifestyle changes. For example, one would be advised to quit smoking if they smoke. One would be advised to limit their alcohol intake if they do take alcohol. And certain meals will have to be omitted to prevent the exacerbation of this particular condition. So a diet will be given to an individual to help them cope with this diagnosis. It's therefore important that when one suspects that they have peptic ulcer disease, they quickly seek medical attention so that a diagnosis is made and the appropriate treatment is started. Why? Because peptic ulcer disease can have fatal complications, and these complications include a bleeding peptic ulcer. The ulcer may start to bleed on the inside. Then it may also perforate. And of note, it's because of these complications that this disease particularly has a high rate of mortality. I therefore encourage you to seek medical attention and start the right treatment when you suspect that you may have peptic ulcer disease. That being said, thank you so much for joining me on this one, and see you on the next one.